Hi everyone. In my last video, I said that I would make another video talking about guidelines, tips for doing exposure therapy. Well, here's that video. If you go online to my website, abramowitz.com, or if you click on the link below, you can download a handout that I give to my patients when I'm working with them doing exposure therapy, and it's called 8 Guidelines for Conducting Exposure. This is really a tip sheet for how to do exposures that are most likely to be successful. And I thought that I would spend a little bit of time kind of going over, hitting the highlights for you in this video. So the first thing is that exposures should be planned and structured. What I mean by that is that you need to do some work on the front end to kind of set up or engineer the exposure practice before you do it. It's not good exposure if you're just kind of waiting for random situations to come up, or if you're counting random situations as doing exposure. I run into lots of people who say, exposure therapy didn't work. And I ask them what exposures they've done, and they say, sometimes I have to touch knobs and doors, or I go driving and I have to pass pedestrians. But that's not planned exposure. Chances are they haven't thought ahead of time about what they're going to be getting out of the practice, and they're white-knuckling it as they're going through it. And as you're going to see in a minute, that's not how we do exposures. So we got to plan them out. Figure out on the front end, where are you going to do this, and what time of day, and how long is it going to last? Are you going to have somebody go with you, or are you going to do it by yourself? How long are you going to stay in this situation, and what's your backup plan in case things don't go the way you planned it? Number 2 is that exposure can be gradual, but it doesn't have to be. The more we're learning about how exposure therapy works, the more we're understanding that, sure, it's fine to do kind of gradual exposure using a hierarchy, getting more and more difficult as you go up the rungs of the ladder, but you don't have to do it that way. In fact, I often recommend doing exposure in the order of the things that are going to help you to get back to your life more quickly. So if there's an exposure that would help you to be able to function and do something that you really want to be able to do, that's what I would do first. Of course, it can go gradually, and that's why it's important to make a list, plan out what you're going to do step by step. Third, you got to expect to feel uncomfortable during exposures. If you're not feeling uncomfortable while you're doing exposure, you're not doing it right. I hate to say that because it's unpleasant to feel uncomfortable, but the discomfort that you have, the anxiety and fear and that fight or flight response that you have during your exposure practice, that's pure gold. You're going to learn from that you can manage those feelings, that anxiety and intrusive thoughts, that these things are safe and they're manageable. The goal of exposure is to teach you new information, including the information that anxiety is manageable. So lean into it. It might make things more difficult when you're doing the exposure. It certainly will make it more uncomfortable, but in the long run, it's going to help you more. And I like to call that desirable difficulties. Make your exposures desirably difficult. They're difficult while you're doing them, but in the long run, that's desirable because you're going to have better long-term outcome. Related to that is my 4th point, which is don't fight your fear. You gotta lean into it. The more you do rituals or avoidance strategies, or even subtle avoidance strategies to fight your fear during the exposure, you're not learning what you're supposed to learn, which is, again, the situation is not as dangerous as you think, anxiety is safe and manageable, and those intrusive, unpleasant thoughts and uncertainty, those are all safe and manageable. Don't do exposures where you're just kind of white-knuckling it through. When you do exposure, you need to say, I'm going to do this, I'm going to feel uncomfortable, I'm going to prove to myself that I can get through it, even if it feels really unpleasant. Another tip that's related to that, number 5, is don't use subtle avoidance strategies or subtle rituals. Again, you've heard me say this already. You need to face that fear, you need to lean into it. And so anything that you're doing, any sort of subtle sort of resistance to the anxiety, and you know what that is. I don't have to tell you. You know when you're taking a shortcut or when you're avoiding something or doing a ritual. Those things are going to make the exposure less effective, the extent to which you do them. Now, number 6, you want to use exposure to test out your negative predictions. And what I mean by that is the goal of treatment is you want to put these predictions on the table. If I eat a chocolate chip off the floor, I'm going to get sick. If I go driving past pedestrians, I'm going to hit someone and then the police are going to show up and cart me off to jail. If I have an intrusive thought about molesting children, then I'm going to turn into a child molester. You want to put those beliefs to the test, those predictions to the test. So when you're doing exposure, you want to go to the form that is also on my website, the exposure practice worksheet. You can also view a video about that. And you want to make these predictions about what you're afraid is going to happen. And then when you do the exposure, you're going to test this out. And the exposure practice ends once you've collected data to test out this prediction. Remember that we're not worried so much about habituation anymore. That's kind of an older concept. Sure, your anxiety might go down, and that's fine. But what we're really concerned about is testing out these predictions. So make sure you have a clear, testable prediction, and that when you do the exposure, it kind of activates that fear that that prediction might come true, and you're going to stick it out in that situation, or you're going to confront the situation in a way that's going to put that prediction to an honest test, and you're going to be able to collect data to help you learn new information and change your mind about the dangerousness of the situation, of the intrusive thoughts you're having, of uncertainty, of anxiety, and that's what's going to help you to get over your problem with OCD or anxiety. Tip number 7 is rate your anxiety on a scale from 1 to 100. It's fine to pay attention to how anxious you're feeling, and keeping track of that is a good thing. You might notice that it goes down over time. That's the natural habituation response, and if that happens, good for you. If it doesn't happen, that's another thing that you can pay attention to and recognize, hey, I am doing this. I've been in this exposure for 20 minutes, 40 minutes, 60 minutes. My anxiety has stayed really high, and I am getting through this. I can do it. I haven't lost my mind, or I haven't died, or had a heart attack, or had to escape. I can get through this. And so when your anxiety stays high, that helps you learn that you can manage high anxiety, because you can. And then the last tip is to vary up your exposures. It turns out that we learn best when we confront our fears in different situations under different circumstances. That just helps us to generalize the learning that's taking place during exposure. And generalizing means that we learn that it's not just one particular floor that's safe, or one particular road that you can drive on that you'll be okay, or one particular thought. But it's thoughts in general that are safe, and it's roads in general that you're unlikely to have an accident in, or it's floors in general that are generally safe. And so the more you can vary up the situation where you're practicing in, whether there are other people around, whether it's daytime or nighttime, or different days of the week or times of the day, the mood that you're in. You know, some people report in on how they've done with their exposure practices during the week, and they say, well, it was really a stressful week. I couldn't do the exposures because I was so stressed out. And I tell them that's the perfect time to do exposure, to learn that you can do this when you're feeling happy, when you're feeling sad, when you're feeling stressed out, when you're feeling angry. The exposures are going to help you best when you learn that you can do them under any circumstances, and that includes external circumstances. It also includes internal circumstances. So I hope you take these 8 tips under consideration the next time you're practicing exposure. Please like this video, subscribe, click on the links below. If you like this information but you're hungry for more, you can always check out my book, Getting Over OCD. That book contains lots of elaborations and examples of how to implement these 8 strategies. Thanks for watching.